Hello friends, I'm Jyoti Ekot and today I'm going to talk about the reporting expedite reporting requirements and their timelines. So let's start. Firstly, we see what is expedite reporting. So the expedite reporting, this applies to reports from a spontaneous sources and spontaneous sources and from any type of clinical and epidemiological investigation independent of designs or purpose. It also applies in a case not reported directly to a sponsors or manufacturer. For example, those found in a regulatory authority generated adverse drug reaction registries or in a publication. And then we go forward to the next one, that why should we report it. First is in that the first is a single case of a serious and unexpected adverse drug reaction. Cases of a adverse drug reaction that are both serious and unexpected are subject to the expedited reporting. The reporting of a serious expected reactions in a expedite manner varies among countries. Non-serious adverse reaction, whether expected or unexpected, would normally not be subject to expedited reporting. Then second one is other observation. In other observation, this includes any significant unanticipated safety finding from an in vitro or animal epidemiological studies or clinical studies that suggest a significant of a human risk, such as evidence of mutagenicity, teratogenicity, carcinogenicity, and lack of efficacy with a drug used in treating a life-threatening or a serious disease. So, and in that, our next one is a lack of efficacy. The evidence of a lack of efficacy should normally be expedited, but should be discussed in the relevant periodic safety update report. However, in a certain circumstances and in some regions, individual reports of a lack of efficacy are considered subject to a expedited reporting. Medicinal products used for the treatment of a life-threatening and a serious disease, vaccines and contraceptives are the examples of classes of medicinal products where the lack of efficacy should be considered for the expedited reporting. Clinical judgment should be in a reporting with the consideration of a local product labeling and disease being treated. Then in that, our next one is a overdose. So in reports of a overdose with a no associated adverse outcomes should not be reported as an adverse drug reaction. Case associated with a serious adverse reaction are considered expected to expedited expedited reporting unless otherwise specified by a local regulation. Then they should be routinely follow up to ensure that the information is complete as possible with the regards to symptoms, treatment and outcomes. The MAH should collect any available information on overdose related to its product. Beyond then we see the minimum requirements of a reporting. In minimum requirements of a reporting, the basically for the purpose of a regulatory reporting, the minimum data element for an adverse drug reaction are identifiable reporter. Then second one is identifiable patient. Then third one is an adverse reaction, and the fourth one is a suspected product. So the lack of any of these four elements when that the case is considered is incomplete. However, the marketing authorization holders, that they are also known as MAH, are expected to exercise to diligence to collect the missing data element if possible. In general, the reporting of a serious and unexpected adverse drug reaction is required as soon as possible, but no case later than 15 calendar days of initial receipt of the information by the MAH. The frames of other types of serious reports vary among the countries depending on their sources, unexpectedness, and their outcomes. The regulatory reporting time clock is considered to start on the date when any personnel of the MAH first receive a case report that fulfills a minimum criteria as well as the criteria for expedited reporting. In general, this data would be considered a day zero when a additional medical relevant information is received for a previously reported case. The reporting time close and it is considered to begin again for submission of a follow-up report. So we go forward to our next one, that is the criteria on how to make the expedite report. The SIOMS forms, that is a Council of International Organization of Medical Services, has been widely accepted and standard document for expedite adverse event reporting. However, no matter what the form or format used, to which it may arise or varies among the different countries, it is important that the certain basic information or data elements when available be included with any expedite reporting, whether in a tabular or a narrative presentation. It is recommended that the medical dictionary for regulatory activities, means MEDRA, be used for medical coding informations. The standards of electronic submission of individual case safety reports, and that are ICSR, according to the ICH E2B and also the M2 guidelines should be implemented. Then we see the key data elements for inclusion of expedite reporting of serious adverse drug reactions. So, on the based on the ICH guidelines, the following are recommended key data elements for the inclusion into expedite reporting of a serious adverse drug reaction. Included first is a patient detail. In patient detail, it is a initial. We have to register their initials, like other relevant identifier, in which the patient number, and then gender, age category. It means the adult or elderly patients, or date of birth, then concomitant condition, then we have to note that medical history, then we have to see the relevant family history also. Then our second one is suspected medicinal products. In suspected medicinal products, the brand name as reported, then international non-proprietary name, then batch number, lot number, indication which the suspected medicinal products was prescribed or tested, then dosage forms or strength, then their daily dose, like specified units, for example mg, ml, mg per kg, etc. Then the regimen or route of administration, starting date or ending date, or stopping date, or a time or a duration of a treatment. These all are included in a suspected medicinal products. Then our third one is other treatments. In other treatment, it includes the same information as in the I told in a suspected medicinal products, should be provided by the following, like concomitant medicinal products, including a non-prescriptional, over-the-counter medicinal products, then herbal medicines, remedies, dietary supplements, complementary alternative therapies, etc. And then our fourth one is a detail of adverse drug reaction or all available adverse drug reaction. It includes the full description of a reaction, including the body sites and a severity, the criteria for regarding the report as a serious, then the description of a description of a reported signs and a symptoms, then specific diagnosis of a disease, then de-challenge and re-challenge information, then a relevant diagnostic test result and laboratory data, and then for the fetal outcome or a stated cause of death, the relevant autoscopy or post-mortem findings. Then our fifth one is administration and MAH detail. It includes the sources of reports like a spontaneous epidemiological study, patient survey, literature, etc. The date of event report was first received by a manufacturer or a company, then the country in which the event occurred, or a type like initials and follow up, and sequences like first, second, third, etc. For case information reported to the authorities, then a name of address of a MAH, then a name, address, and electronic mail address, or a telephone number, or any landline number of a contact persons of a MAH, then identify regulatory code or a number of marketing authorization dossiers. Then our sixth one is a detail or a reporter of an ADR, in which it includes the name, mailing address, electronic mail address, then a telephone or telephone or mobile numbers, then a report type, it includes the consumers or healthcare professionals, etc. Then professions like a specialist, that all about the expedite reporting criteria or timeline and requirements. Thank you.